Thank you, Mark. I left a sort of shameless plug for my new book up on the screen here. It's not really what I'm going to talk about today. What I want to talk about relating to the issue of shared decision-making is something very radical in our current context. What my work has been about since my father's death has been looking at healthcare as an industry, and specifically as an industry serving consumers, what patients are called and everything else. And one of the questions I ask really is, can we find industrial reasons that it's so broken? It is unusual to have an industry this size that is so bad at so many things. And that's probably a moment to say that there are parts of this presentation that may very well offend some of the people in the room. So I want to make clear that I really do come at this from an outsider's perspective, which doesn't mean that I don't have a lot of respect for all the excellent work that's done in the field. And I hope no one takes it that way. It's more about comparing what we talk about in healthcare, how we think about healthcare, with how we think about everything else. I will tell you that this book that that I've written is an argument for rebalancing the system towards true consumer-driven, to be a true consumer-driven industry. And when I talk about rebalancing, what I mean is taking us away from assuming that there is going to be someone between us, and by us here I mean the patients, that's my role in the healthcare world, is to be a patient, and the providers. Almost every interaction is intermediated in this system. And what's missing is consumers as the direct economic force. There's a lot of work I know going on in this conference about how this profession can be better at providing care, at being safe, at offering quality, and at providing appropriate amounts of care. But since the dawn of professions, all professions, we have a lot of data that says that no profession is ever very good at reforming itself. Whether we like it or not, the fundamental economic incentives that a society provides drives behavior. I want to come back to that in a second. Let me just start with why I'm here. This is a picture of my dad and my first son, taken about 4 years before his death. We brought my dad into a hospital for precautionary reasons. They admitted him. He was a bit short of breath. Within 24 or 48 hours, had developed a series of infections that meant he never left the hospital. We all know the numbers. They're very, very large. It's the type of people who suffer errors, preventable infections, what have you, and the enormous damage that causes. That's not what I want to talk about. When I think it was about 4 or 5 weeks after my dad's death, I read an article that Atul Gawande wrote about the effort to get hand washing and other sanitary protocols into hospitals. So that's the first time I learned how common hospital-acquired infections were. I have no idea. I'm not part of the healthcare system. But I learned something else that has really driven everything I've written about and thought about since then, which is it's really strange that a business needs to be lobbied for a low-cost way to save customers' lives. You know, I was in the movie theater business. Doesn't seem like a comparable business. But we had very strict rules on how long between a soda spilling on a floor and it being mopped up you could have. Very, very strict. Why? Because someone might slip and fall. Now you think, oh, well, you're just trying to avoid being sued. What difference does it make? We had very strict rules, and they were enforced. And if you see a well-run movie theater chain, people are spilling stuff all the time, and people aren't sliding around. I thought, now this isn't about slipping over sodas. This is, to some degrees, more complex. But what does it say that these reformers have to run around the country basically begging hospitals to adopt something that costs almost nothing that saves lives? Now, if you're in the profession, you say, well, we got to do a better job. If you're in business, what you say is, something's wrong with those incentives. Something's wrong. Incentives is misunderstood, and I want to come back about it, but one of the things that needs to be understood about incentives is they're not just about money. We talk a lot about money in healthcare, which is really weird, of course, because we deal endlessly in matters of life and death. And my interest in healthcare, although I will talk a lot about money, isn't about money. It's about knowing I'm going to be a patient one day, knowing my kids are going to be patients, still having a mother who's a senior citizen, and recognizing that money is a proxy for quality and the incentives around quality and service. That's why I'm here. I mentioned incentives. So I must tell you, in the time I've spent in healthcare in the last 5 or 6 years, I have been amazed at how many people there are who are near saints. Undoubtedly, a lot of you focus on the bad apples and the doctors who shouldn't be practicing and the institutions that aren't well run. But I got to tell you, I've been in the business world my whole life. I was a banker to start off my career. We had nobody in banking who went into banking to make the world a better place. I know I didn't. But in healthcare, we have a lot of people like that, right? And so it tells you the power of economic incentives that almost everything that happens in healthcare, if you step back and stop thinking healthcare is special, you can explain by an economic incentive. There's one thing I got to make clear about an economic incentive. It's not binary, right? It's not if Medicare pays you per procedure, you operate on every single patient, no matter how healthy, right? It's all about at the margin. At the moment where I'm at the border between do I recommend a procedure or not. It's the marginal physician, the marginal institution, the marginal procedure. That's where incentives operate. And I notice a lot of people in this field don't understand that. They'll say, I would never give somebody a drug they didn't need or a test they didn't need. That's not what an incentive is. That's not how it works. It works at the margin, and that's what makes it so powerful, is it moves decisions from A to B where they're close. There is no escape from incentives. As the communist world found out, you simply cannot eliminate incentives. You can hide them, you can distort them, you can morph them. They always exist. All of us are dominated by incentives. We all have to feed our families and ourselves. The other thing is they're not static, and this is something very much misunderstood by the government. So the government thinks it can give you a penalty for killing a patient, and we've changed the incentives, but it's static. Real incentives have feedback loops, and I want to come back to that. So if you want to incent people to use technology, you don't have meaningful use rules, because they're rules, they're targets. You have competition. And I want to show how that works in the world outside of healthcare and why information technology has failed inside healthcare. But first I want to talk about all of the fictions and myths that prevent us from seeing that healthcare should be a consumer-driven industry. And that's really what I'm going to talk about for the rest of us. All the things we all believe, we all shake our head at, absolutely true, that are completely false, and that represent pure island thinking. And in some cases, in fairness, were true a while ago. But with healthcare at 18% of GDP and a substantial amount of everybody's consumption, they're no longer true. Let me start with the biggest thing we all believe, which is none of us can afford healthcare without insurance. Besides the fact that that can't possibly be true, somebody must pay for it, it's not true for the overwhelming bulk of our population. So Becky is an actual 23-year-old who started with us 2 years ago. And I sat down and said, if I looked at all of the ways Becky's going to pay into the healthcare system over her lifetime, everything, right? Her share of premiums, my share of premiums, I'm just taking it out of her pay. Where else would I get it from, right? Her Medicare taxes, the percent of her federal and state taxes that go to fund Medicare and Medicaid, her Medicare premiums down the road. How much is Becky going to put in the system? And I put a couple of big assumptions on this. One is that Becky is the sole breadwinner in her family, which reduces the number. The second is Becky remains solidly middle class her whole life, which reduces the number. But this gives you a sense of what somebody, Becky started out earning $35,000 a year. I assume her income grew 3% a year, which is historically what's been the case in this country for most people, just by aging, just by getting older, your income grows. I also assume Becky never gets really sick. She never has meaningful out-of-pocket costs. And then I did one other assumption so absurd that you probably shouldn't even look at this slide. And that assumption is that healthcare costs grow only at the CBO's projections, which are 10 years. And so the balance of Becky's life, healthcare costs grow at 0. I had Becky live to 80, and I had her husband leave her at 65 so she didn't have to pay his bills. So Becky will put almost $1.9 million into our healthcare system over her life. If I look at her real compensation, what I pay her really, not just her salary, but all her benefits and everything, that's close to 30% of what she'll earn over her life. She'll fund her kids, she'll fund her spouse. For those of you who are skeptical about the analysis, if healthcare costs grow at 0 from now till the end of time, 0, Becky's number will be only 1.2 million. Now, why is this the first slide? Because everything I'm about to say has to be in reference to this slide. We are talking to a population that we're asking to put in a middle-class lifestyle, $1.2 million to $1.8 million, if they're lucky, over their lives. And when you talk about the value of these intermediaries, remember that. I want to add one other thing before I move into this more quickly. Let's talk about the neediest in our society. So between Medicare and Medicaid, the federal and state governments will spend about $850 billion in subsidy this year on top of what the beneficiaries pay themselves. If we wanted to, we could give 100 million people $8,500 a year to spend on their health care. For a family of 4, that's $34,000. I'm not suggesting we do that, but when you think about just the money, remember how much is in the system today. When we think we're protecting ourselves, what we're really doing is deluding ourselves. What this system is great at is hiding how much Becky and everyone else is putting in. I'm actually going to skip this for just a moment. We all know why we have to have an insurance-based system. You want everyone to agree with you at a healthcare conference, make the following statement. Only 10% of people in the country consume 70% of the healthcare in a year. So we know we must have insurance, right? Has anyone not heard that statement? Here's the problem with that statement. 100% of the cars every year are bought by less than 10% of the population. 100% of college educations every year are paid for by less than 10% of the population. 100% of the weddings. 100% of the refrigerators. Now, it's a little unfair, but it's worth thinking about healthcare instead of being something special as being an expensive good and service that we all will use over our lives, like all these other things. We use it a lot some years and very little other years. We have tons of industries like that. Now, healthcare is a little different because there are some people who every single year are in that top 10%, who are just sick over their whole lives over for long periods of time. But for most of us, we're going to spend a year or two in that top 10%. Just like we're going to buy 4 or 5 cars and go to college and maybe send kids to college and have 1, 2, or 3 weddings and, you know, buy a refrigerator every decade. Expensive capital goods and services all look like this. Healthcare is not special. What makes healthcare special is that the other 90% of us use 30%. That's not true in any other expensive good and service. That only 30% is over $800 billion a year. By itself would be the largest consumer industry in the country. Well, we all know that consumers can't do the work necessary to be healthcare consumers. So what's the point? Right? That's why we need the system we have now, because there's somebody out there taking care of it for you. I don't think anybody who says that has ever looked at any other industry. Because what makes consumer-driven industries consumer-driven is that the providers do all the work. They're chasing you. I think a lot of people in healthcare economics seem to think that Walmart was created when an angry mob marched on Neiman Marcus and said, "We demand lower prices." What happens in the world outside of healthcare is somebody wakes up in the morning and says, "You know how I'm going to make my billion? I'm going to be the low-price leader." You think anyone's ever said that in healthcare? You know how I'm going to make my billion? I'm going to be the service leader. I'm going to be the quality leader. I'm going to be the appropriate amount of medicine leader, and I'm going to invest in that brand and make sure everybody knows about it. So all over I hear, well, consumers just can't possibly, you get hit by a bus, you can't negotiate your care. So let's be clear about this. In consumer-driven anything, you don't negotiate anything. You don't go into Walmart and say, toothpaste, huh? What was the cost of that toothpaste? I only want to pay 5% over cost. They give you a price, they say it's the lowest price, you pay it or you don't pay it. In our system, we have this. This is the real cost of having an intermediary. My son had a ruptured appendix and needed an appendectomy, at least according to 99.9% of medical literature. He had an emergency appendectomy, and here's the first response from our insurance company. Our medical reviewer has determined we cannot approve your hospital stay for acute appendicitis. We do not have enough facts to show it was medically necessary. Now, I don't blame them. It's what I would do if I would run an insurance company, right? Make it as hard as possible. Administrative complication goes into the rate base. It's smart. But whenever somebody says to me, the problem with consumer-driven care is consumers have to do so much work, I really wonder what on earth they're comparing it to. I'm the CEO of this company that these guys insure. I had to fight with them. Many of you know who Kenneth Arrow is. He wrote one of the most important policy papers in healthcare, arguing that information asymmetry between customer and doctor meant you could never possibly have a functioning market. The customer would just do whatever the doctor said. This is one of those things that I think we've outgrown in healthcare, and we've outgrown it for a few reasons. One is we have TripAdvisor, or we have Patients Like Me, to be more specific about our care. We have a lot of ways that people get information about healthcare other than from their doctor. Truly didn't exist when Kenneth Arrow wrote 50 years ago. But here's what's more important. We require our patients to do that work, and I know that's a lot of what the work is going on here. Healthcare is no longer just about your house is on fire, we got to put it out. We got to fix this. Healthcare is not like auto repair. It's increasingly about a variety of treatment alternatives, often long-term, involving interaction between the patient and the healthcare system. That requires patient effort. And so whatever you believe about Kenneth Arrow's original point, it's irrelevant. There is no healthcare system without patient involvement. There are too many decisions patients have to make. The last thing, of course, is we've now had about 50 years, 60 if you just look at private insurance, of having intermediaries play the role that Kenneth Arrow said they should play. They should be the customer for us. And they're horrible at it. They're just unimaginably bad at it. And so if you still think Kenneth Arrow was right, you have to consider the story about the bear and the two guys in the forest. Everyone knows this. The bear's chasing the two guys. One guy stops to change into sneakers. And his friend says, "You idiot, you can't outrun a bear." And he says, "I don't have to outrun a bear. I just have to outrun you." And so whatever you think about the theoretical correctness of Kenneth Arrow, all we have to do as consumers is be better than intermediaries for the system to be a lot better. Many of you saw Steve Brill's piece last week about prices in healthcare. This is a point he makes very strongly. Prices in healthcare have no meaning. So if we move to a consumer-driven system, this isn't still what would happen. On the left, you see Medicare's bill for Medicare's statement to us from the hospital for killing my father. They charged only $636,000 for the service. And then on the right, you see my effort to say, if I had rented Dad a room at the Four Seasons, which is the most expensive hotel in New York, at $1,000 a night, I leased $1 million of hospital equipment, put it in his room, gave him an hour a day with a physician, which is probably about 5 or 6 times what he got, and gave him nurses round the clock. That most extravagant possible treatment, I also gave him room service, but included in here, is $155,000. Now, obviously, nobody paid $636,000 because in the healthcare system, we don't use prices the way we use it everywhere else to communicate actual information on costs, scarcity, need for investment, you name it, right? Here's what we communicate, because every bill communicates something important, and I'm sure all of you have gotten bills from insurers. They communicate the following. You're lucky you have us. You can never handle this yourself. My aunt got a bill from her insurer which said the hospital charges were $105,000, her share was $300,000, and the insurance company had paid $800,000, and the rest was other insurance credits. Nothing is being communicated there except, thank goodness you have insurance. A lot of people think we can fix this just through payment reform, that if we can, or by making healthcare cheaper, that if we can just improve efficiency in healthcare, we can bring costs down and make it more responsive. So, and we've been doing this forever, right? Productivity in healthcare has gone through the roof, but of course it's had no impact on prices because there's no competitive mechanism for it to have an impact on prices. Let me give you the ultimate example. I love this example. Many of you obviously know that the Reagan administration enacted a prospective payment system for hospital, and that for the most part, most hospital bills, inpatient for a long time, outpatient for shorter, have been what would be called bundled or fixed payment on diagnosis. And the impact on usage has been extraordinary. The days in hospital per Medicare beneficiary have dropped by 63% since prospective payment reform. The total days in hospital, even though we have so many more Medicare beneficiaries, and the population has almost doubled, itself has declined by almost 50%. And the total days in the hospital are down almost 60%. You will never see a reform that has a greater impact on true cost. When this reform happened, a night spent in hospital was by far the most expensive element in the system. So you know what happened. Once we cut 60% of the cost out of the system, prices tumbled. Right? No. Weirdly, we reimburse 5x, which is somehow bigger than minus 60. If we cut the hospital days by 99%, the result would not have been we save money, right? We would have reimbursed by more. And here's a hint as to what's really going on. So Medicare reimburses 5 times what it did before prospective payment reform. The hospitals claim their costs have grown 7.5 times. So in other words, Medicare has cut the usage in half, paid 5x, and convinced itself it's getting a better deal. It only paid 5/7 of the increase in cost. One of the problems with not using prices is it causes us to do things and think things that are weird. So here's what we think is happening in healthcare, right? We think that Medicaid is paying a lot less than Medicare, which is paying a lot less than private insurance. This is from a single study done in Michigan on, I believe it was actually appendectomies in the mid-2000s. It's obviously very hard to get true comparable pricing. So here's what we think. There's some cost shifting going on, something unique to healthcare, right? That private insurance is really paying, because we all know all Medicare patients are served at a loss, so private insurance is paying for that and for Medicaid, right? And you only can believe that if you've never been outside the healthcare system, because here's hamburger pricing. McDonald's makes money at 99 cents. They're not actually being subsidized by DB Bistro. Cheesecake Factory makes money at $11.95. DB Bistro makes money at 32 bucks. They don't sell many of them. There's foie gras in the burger. I've had it. I've had all 3 of those, right? What's important about all 3 of those? They're all hamburgers. They're all lunch. If you stand outside of healthcare, what you would say is if I've got 3 different price regimes that are this wildly different, what I've got is 3 different products. And I think it's something actually that people who focus on price miss, right? Which is where the customer is obsessed with volume, as in private insurance, I charge a lot of money. Where the customer is obsessed with price, as in Medicare and Medicaid, I do a ton of volume, which means I perform the service differently. Now, I'm not here to tell you how doctors perform their services and hospitals do, but this can't be false. This is how the world actually works. We may not recognize it in healthcare, we may not believe it in healthcare, but if you have a price imposed upon you, you figure out a way to make money at those prices. If you were really losing money on Medicare and Medicare patients, you wouldn't take them. There'd be no cost shifting. Here's something else from outside the island. What is innovation? What is growth in technology? There's only 2 industries where anyone seriously says technology is driving up costs, right? We say it in healthcare, we say it in defense. So in 1965, there were somewhere between 10 and 20,000 computers on Earth. There weren't many more people who knew how to use them. And that's what a hospital room looked like in 1965. Both industries have undergone a lot of technological change. In computers, what happened is 100% of the world population got PhDs in computer science, which enabled us all to carry a little computer in our pocket. The single most complicated thing on Earth, if in 1965 you said, I've actually got 2 of them right in front of me, every person on Earth is going to have one of these, you would have been committed. The most personal, individualistic, heterogeneous service on Earth is the one on the right. The one on the left is the most accessible industry on Earth, even though 45 years ago, or 50 years ago, was thought of as impossibly complicated for anybody other than 50,000, 100,000 people on Earth to understand. The one on the right is now complex beyond understanding for even the people in this room who know more about it than anyone else. It's my dry cleaning bill on the left. And this is the most important lesson that I can offer, which is do not have your dry cleaning done in New York. The prices are ridiculous. This is the most expensive dry cleaner in New York. And what's interesting about what they've done is in response to the Congressional Dry Cleaning Technology Act, they invested in information technology, and they took it an extra step, right? They actually can tell you every single shirt. Look at the first one, a Barney's New York shirt, blue, solid cotton. A Paul Smith, white, with stripes, light blue. Why? Interestingly, that's incredibly bad for them, because when they lose one, I know exactly what shirt it is. So what did they do? They sat there and said, okay, all the other dry cleaners now have computerized bills. I'm going to take it a step further so I can charge more. So yes, I take the risk of if I lose a shirt, I can't say, 3 shirts, I only took in 2 shirts. That's a mistake in the bill. You say, you lost my Paul Smith shirt. So that's how the digital age works, right? Is that we're all endlessly playing with stuff. What makes sense? That dry cleaner literally made this decision to compete with the guy across the street. This is my completely unfair representation of the meaningful use rules. And these are the instructions to an iPad. All of you who have bought an iPad know an iPad has no instructions. That's how information technology actually works. If it's not usable, it's useless. And we know this everywhere, except one place. This is going to be an unfair slide, I'm sorry. I'm going to blame this one on Otis Brawley. Otis Brawley wrote, if your institution has a center of excellence, you probably have an excellence problem. If you call yourself patient-centered, you aren't. You're talking to yourself. This is how people talk to customers. This is a customer-centered retail establishment. They don't use the word customer-centered anywhere. No one does. This is the single stupidest idea in the history of mankind, and as a result, it completely transformed the world economy. And in thinking about innovation about healthcare, you have to think about the container, the shipping container. So the shipping container has changed everything in our world, right? And it was a terrible idea, right? What happened? The most expensive thing you could do is put something on a ship and run that ship across the world, right? Incredibly expensive to send a ship somewhere. So what did the shipping container do? The shipping container said, you know what we're going to do? We're going to fill ships with empty space. Instead of having ships carefully loaded to maximize the use of space, you put a motorcycle or a car in a ship, that's a puzzle, right? How do I fit that? We're not going to do that. We're going to put everything in a box. So most of the box is empty space. If you ever open up a shipping container, most of it is empty space. And so ships are filled with empty space. Could there be a dumber idea than to take the most expensive thing you could do, ship, and fill a ship with empty space? Well, of course, what the shipping container did is it meant that you could load and unload ships almost instantaneously, within hours. I've lived next to a port, I live next to the port of Miami. They turn ships around, massive ships in hours. It meant you can build much, much bigger ships. It's actually impossible to build a big ship unless you use a standardized container. You can't reach everything to make sure that the toys are packed correctly with the motor vehicles. And so everybody hated this idea because it cost everybody their job, right? It meant that all the ports that were great ports lost out to new ports that invested in computerized shipping. And it is the reason that the prices of most goods have declined over the last 50 years, and that supply chains are now Earth-long instead of having to be near a river or near the plant. The economic transportation of this may be greater even than the internet. It's in the trillions of dollars in cost saved. And it's a terrible idea. Everybody in the business hated it. So it's about a very important phrase, which is creative destruction. I was at a meeting the other day where the head of one of our local hospitals in New York got angry at me for saying that there was no real incentive for saving costs in healthcare. He said he had sat down with a group of the other hospitals, the insurers, the doctors, the nurses, and a couple other people, and they'd all sat around and tried to find the best cost-saving ideas. So it's the reason we don't ask turkeys what to serve for Thanksgiving. Really innovative ideas hurt people's businesses. And so when we sit around and say, how do the stakeholders agree? We're not talking about real innovation. It's sad, it's ugly, it's the reality of our world, but it's what's changed every single other industry on Earth. Real innovation is truly disruptive and truly destructive. I'm actually going to skip over this except to make one point. Obviously, there's some bigger public policy issues here, and there are a couple things I think aren't widely understood about where the United States stands. The United States actually spends relatively little of its healthcare spending out of pocket. Less than most, these are just OECD countries, less than most OECD countries, it's now closer to 11%. France spends a little less, the UK spends a little less, not a lot less. Most countries have more consumer skin in the game. The United States spends relatively little of its health spending from the government, but the gross number itself is one of the highest in the world. Now for a little perspective, here's Singapore. Singapore, which has the only, South Africa's as well, but Singapore is the only rich country with a true consumer-driven health system. 54% of the amount sent in Singapore is spent out of pocket. And what's interesting about that 54% is every single healthcare decision in Singapore is made by a patient. They actually buy it. Even if they're going to be fully reimbursed, the government isn't the payer, the patient is. We're so used to insurers and Medicare paying on our behalf, we forget they could also give us the money to pay, and that would transform the system. In Singapore, only a third is explicit health spending. Interestingly, some of it is to run a parallel healthcare system that competes on price. Singapore spends only $2,400 per capita on public health, but here's the killer. Singapore spends 4% of GDP on healthcare. It's as rich as we are, people live as long, the healthcare system's as good. 14% of GDP less than us, and less than almost any other single payer or other country. It's a lot of policy stuff. Let me come back to what I think this is really about. One of the things that's unique about healthcare is that there's 310 million of us who have a healthcare story. Sometimes it's as simple as the doctor forgot who I am, or they lost my test, or the generalist didn't talk to the specialist, or one specialist didn't talk to another, right? Sometimes it's much more serious. Sometimes it's about being taken for procedures meant for other patients. My father was twice. And as we all know, they tell you, you have a family member in a hospital, try to be there at all times, right? Imagine if FedEx said, we'll deliver your package, but it's best to hold on to it during the process. In a high-tech world, this is insane. We're so used to it, we don't even realize how absolutely absurd that is, but we all know it's necessary. And obviously all the way to the extremes of people dying from mistakes. We talk a lot in health policy about very big picture things, about money, because there's a lot of it, about big incentives and big economic ideas. What needs to inform us, though, is that these all translate to the little picture, and that every single one of us has a story. That's way too many of us to have a story. Thanks very much.